Medication is ideally designed not to take away the pain completely. Painkillers are ideally prescribed to reduce pain levels just enough to allow an individual to carry out some of their normal functions, some of their normal roles, such as going shopping or facilitating a return to work, or allowing an individual to, say, walk their dog. Painkillers are probably best prescribed, and I do believe that prescribers should actually mention this explicitly, to individuals as an adjunct or an additional way of helping manage their pain. Painkillers could be considered, for instance, to allow an individual's pain to be reduced sufficient or enough to allow them to, say, carry out an essential function or role, be it at work or recreationally. It is sometimes appropriate for staff who prescribe painkillers to prescribe several different types, and that is because we find that painkillers can work well together when they come from different drug groups. It also means that sometimes we can get away with smaller doses and have less in the way of side effects. In addition, there are specialised painkillers such as those used for pain from a nerve origin. I think a note of caution, however, needs to be mentioned about stronger morphine type painkillers. Although on occasion relatively small doses of morphine type painkillers can be appropriate in the short and medium term, the evidence supporting the use of morphine type painkillers for pain long term and at higher dose is poor, and there is some evidence accruing over time that some morphine based painkillers can cause problems long term, such as difficulties with immunity, problems with suppression of hormones, as well as the well-known problems of tolerance and potentially addiction. We'd also advocate, by and large, that painkillers are taken by the clock, morning and evening, ideally, using typically a slow-release preparation. We would not normally advocate taking painkillers on a very regular basis throughout the day, when an individual's spikes in pain can commonly occur as a result of, say, an increase or a change in their activity levels. We would suggest during the day, as an individual goes around their normal activities, where the pain doesn't increase, that they use other, perhaps more psychologically based techniques to help manage their pain at those times. That is to prevent the individual becoming heavily reliant on medication and potentially suffering more in the way of side effects. But often, and for most patients, that's only a part of their solution. And for those patients who do best, a big part of their the benefit that they get is learning to self-manage better. I see a lot of the different techniques and interventions we use within the clinic as being complementary in that regard. So the overall goal really is to help people self-manage and live their lives better.